food, living spaces, transportation, cities, enterprises, energy, and digital trust. We believe technology is forging a brighter future.
Hi, everyone. Good evening. Good afternoon. Welcome to join our last digital industry section, which is about digital healthcare. So although it is a last section, but it is also most important session because it will impact every one of us in our life. So my name is Terence Wong. I'm from the GSMA, heading the APAC 5G industry community. I guess most of you may know me. So in case not, after the session, welcome to have a networking. Okay, so today we have a we are very honorable in our mobile industry event. We also have a lot of healthcare experts coming together to deliver the 1.5 hour content with you guys. So we will learn about what the healthcare sector is adopting 5G for different purposes. So we have the National University Health System in Singapore. We also have a pair of speakers from Thailand, coming from a leading operator, mobile operator AIS, and also their partner from the remote hospital in Thailand. And then next is about a holomedicine section, talking about metaverse using 5G, but not for consumer entertainment. It's on the healthcare. It's quite interesting and very exciting. In the day one, I also heard that the keynote speaker talk about that this is the first very innovative use case among the world to use holomedicine for the healthcare section, for the healthcare services. And then finally, we also have a very good line of a panel from Malaysia, YTL, which is a mobile operator who first rolled out 5G in Malaysia. They already have use case on healthcare. And also we have a leading ICT solution provider, Microsoft, and also Huawei. So about healthcare, I think everyone must be consumed certain kind of healthcare services before. So digitalization in healthcare is already have been promulgated by WHO since 2005. There are already more than 120 countries develop a policy to support this initiative. So in ASEAN, there is a digital master plan 2025. They also putting enhancement of digital healthcare as one of the priority for public services. Of course, with different reasons. The resources. If you look at these two tables, these two charts, you actually find out that the number of physicians per population and the number of hospital beds per population, most of the ASEAN countries actually is still below the world standard, which means there are resources gap compared with other countries. So how can we address this? So we need digital healthcare. Also, people are expecting more equitable, accessible, universal for use for consuming the healthcare services. Another reason you see more middle class rising in the region, so they also have a high expectation on the healthcare services. And of course, the aging population is another burden to the existing healthcare system. So finally, everyone aware, in the past two years, with the impact of COVID-19, the healthcare system and resources is really being challenged. So we really need technology to address some of the issue. We really expect that 5G is one of the key enablers to support this. So some figure about healthcare market. There actually good news is already over 99% of health organization is already going through some stage of digital transformation because of the reason I mentioned before. And then in the global market for digital healthcare actually is forecast almost double from 2021 to 2025, from 175 billion up to 385 billion. So it's a massive opportunity for going. And then the remote healthcare will have a compound annual growth rate about 70%. And also telemedicine is the key with also 30%. So 5G actually is not just a technology decided for using for a mobile phone scenario. It's much beyond with its capability like gigabit throughput, super low latency, and also the massive communication capability, which can connect millions of devices in a very, very dense area. So there are already a lot of use cases about 5G adopted in the healthcare sector. Just name a few. You can see that the gigabit throughput, which means a lot of high resolution medical image can be uploaded very, very quickly. And then at the back end, Edge Cloud can do the diagnosis, AI, machine learning to help the doctor to do the diagnosis very fast. And of course, a lot of medical equipment can be connected remotely or physically or even wirelessly to monitor the people, the vital signs. So this is really critical to save life in a second. And finally, of course, today we also will hear about AR, VR, mixed reality is already start to be adopted in the healthcare sector. So Dr. Gao will be share us about the holomedicine innovation being adopted in Singapore hospital. I think it's another good news I want to tell you. APAC actually is not behind the other region. We are actually at a very good side on developing this healthcare using new technology. So some of the good case is from China. They already have a standard, talk about how to define a 5G hospital. And then this morning, yesterday, I also heard about KT. They mentioned Samsung Medical Health Center is the first hospital that they get the HIMSS level 7 accreditation about a smart hospital. And also you see Malaysia, Singapore, Thailand. So YTL already rolled out, already working with the first ambulance to provide the smart ambulance in healthcare services. And also, finally, of course, we also have Thailand. We also have AIS and remote hospital. They will going to share us about how they work together to create a smart hospital services in 5G. So now let me introduce the first speaker, Professor Lim Kin Yuen, the Group CTO of the National University Health System. He's also a head and a senior consultant of the surgery department. So welcome, Professor Lim.
Yeah, thank you, Terence. Thank you. Right. I want to firstly thank the host for this opportunity to share some of the work that we are doing at the National University Health System in Singapore, and specifically to Terence. Yeah. sorry. Specifically to Terence for this kind invitation. So it is my pleasure and honor to share our digital initiatives at the National University Health System, specifically in the area of use of AI and 5G. So I was asked to talk about this topic in the context of the post-pandemic or through the pandemic kind of space. And indeed, the pandemic has done many wonders for healthcare because before the pandemic, pre-pandemic, we had a great number of challenges trying to get patients, doctors to use digital technology. But the pandemic forced everyone to use digital technology. So some of the areas that you can see here, such as use of telemedicine, use of AI and automation, into a new model of healthcare delivery. So the trends are really to use mobile healthcare to reach out to people who otherwise have to go to their doctors. So if you think about what happens in ASEAN countries, in far-flung islands in Indonesia, or in suburban areas where access to specialist care is difficult, mobile technology suddenly opens that possibility of doing telemedicine, right? And with the increasing penetration of smartphones and in some places like in China, 5G, we are able to do fairly high fidelity teleconsultations, as well as to use an integration of Internet of Medical Things devices. So these are all great, but remember that the providers, the doctors, the nurses, the coordinators are finite in number. You can have 1 million people signing up, but you don't have 1 million doctors, or you don't even have 100,000 doctors who will look after these patients. So how do we scale up without facing this limitation? You have to automate. You have to use AI. So this is another key trend that's emerged through the pandemic era. So I was asked to write this article in the ASEAN magazine 2 years ago at the height of the pandemic. And I've shared some of the vision of how we can better use digital technology to extend healthcare into the masses, into the community, rather than focus healthcare within hospitals and clinics. So the 3 key pillars for digital transformation are in telemedicine or teleconsultation, the use of AI and automation, and the use of 5G-enabled applications. Now, this might sound foreign to many of us, especially in healthcare and in Singapore in general, but in China, this would be commonplace, right? You saw some earlier examples of how they're already using 5G in ambulances and in hospitals. So I think we are a little bit behind, but we are catching up fast, right? So we are trying to find, not trying, we have applications that require 5G in the hospital setting. So it's not just the doctors and the hospitals providing this kind of services. The consumers, the patients themselves want digital healthcare and services that are accessible, better quality, and at lower cost, right? So this statement encapsulates the key paradox of healthcare, right? We call it the iron triangle of healthcare, where you want low cost, high accessibility, and high quality. But you can't have all 3. So how do you flatten this triangle? The only way to do it is to disrupt it using digital technology, right? So you can provide high quality care with access to almost every individual and at relatively lower cost than if you attended or waited to see a specialist, for example. So telemedicine is already commonplace in Singapore through the pandemic, but I thought I'd share something very important, right? Although we think that telemedicine is now ubiquitous, right? We saw an initial spike in adoption. Up to about 20% of our consultations were turned into telemedicine consultations. But post-pandemic, people went back to their old ways, right? So we only have about 6% telemedicine consultations. And this is, I think, a unique quirk of Singapore because it's so easy to access healthcare in Singapore. You go to any town center, you can see a doctor, right? You don't have to travel 2 hours like in some other countries. So I think this is probably a quirk of being Singapore or being in a small city. Whereas in other countries like Indonesia, where it's more spread out, more far-flung, then of course telemedicine is a must. So we have built an app services that in NUHS that enables patients to transact their healthcare by themselves. So you use apps to pay your bills, to refill your medications, to make your appointments, and so on and so forth. You can do self-monitoring as well, right? So these are present-day capabilities. But we have other capabilities that we want to push out. For example, I'm just showing some screenshots of what are the kind of things you can do today. But really, we want to do something else. We want to be able to talk to our patients. We don't want patients to just press a button on the app, right? We want to have two-way conversations with our patients. And this is where AI chatbots come in, right? So many of you are familiar with chatbots, but I can safely tell you that the chatbots you're using today are what you call Q&A robots. Okay? They literally answer the question that you ask. They're not conversationalists. They're not going to ask you, how's your day? Or you have a specific problem. Can I find creative ways of solving those problems for you? And we are seeing language models becoming much more sophisticated today than they were, say, 2 years ago, right? I'm sure most of you have heard about GPT-3, and the latest ones will be like language models such as Bloom. These models are set to change the way chatbots interact with humans, because these language models are very, very sophisticated. Some of you may not even know that you're talking to a bot, right? Because they are really, really natural in the way they reply. So chatbots are an important way, or at least an important strategy for NUHS to automate and to scale up. Again, I can't have humans answering questions all the time, 24/7. So this is the only way we can scale up our care to our patients in the community. So we have launched a chatbot that is capable of helping patients with chronic disease management. So in this case, we are helping a patient with hypertension and high cholesterol. So you can see the chatbot talking to the patient. So this is actually from the real chatbot that we have launched. It is not sufficiently sophisticated today to answer all questions, but you answer a majority of questions. Okay. So in the end, what we want to do is to automate the whole process, to have a central brain in which all chronic disease patients can be managed centrally. So we built this system called Endeavour AI. So Endeavour AI is our production scale AI engine, right, that sucks in data from the EMR system, processes it, and returns back suggestions to the patients. This is done at scale. It's not one hospital. These are the whole cluster, right, the entire western cluster of Singapore. And at the back end, we give a dashboard to our clinicians to be able to identify patients who are recalcitrant or difficult to manage for direct intervention. So this whole program is called CHAM. So it aims to do chronic disease management in the community. Today we are doing 3 diseases, but once we have gone past the pilot and we are successful, we will scale up to any number of chronic diseases that we want to manage at the community level. So I spoke earlier about automation. This is a very real use case. So if you look at the current care managers in our clinics today, they see about 25 patients a day. And you can see in the top line there that a lot of the day is spent on the phone, right? So 8 out of the 25 consultations are on the phone. But currently, we are underutilizing it because either patients don't pick up the phone or they don't turn up. But if we have a way to use automation, right, then we don't even have to see these patients. And in theory, we can almost increase our single care manager's ability to look after patients by 30% initially. We hope to scale up to in 100 to 200% range, which is entirely possible. It's just down to how sophisticated your chatbot is. So these chatbots are smart because they allow you to enroll, they allow you to ask questions, they allow you to reply, they will alert clinicians if there's something wrong with your patient. And these are not fancy apps. This is WhatsApp, right? So you can see this is a very familiar WhatsApp interface. One of the biggest problems in healthcare is we are working with elderly patients who sometimes don't know how to access digital technology. So we need to give them something simple, right? Almost even my parents and many of their friends all use WhatsApp, right? So it's easy for them to onboard. It's something they are using on a day-to-day basis anyway. So you can click and record your blood pressure. They will send you back your blood pressure and so on and so forth. Yeah. All right. So these are all the kind of chatbot responses, right? And none of these responses are cookie cutter responses, right? They can vary a little bit depending on the style and the patient's responses. Okay, I'm just going to walk through this a little bit so you can see your record. You can record different kinds of blood pressure, and you can even see if your blood pressure is very, very high. I think some of you will have high blood pressure. All right. yeah, the bot recognizes it and tells you, oh, if you're feeling unwell, please see a doctor. So there are safety margins built into this. And this is the reason why it's so hard to digitize healthcare, because there are real risks, right, to automating this. You need to think about all possibilities, before you can actually deploy such solutions. Okay, so I'm just going to walk to the last slide. So this is our NUHS plan in terms of how we want to onboard 5G technology, right? And why do we need to use 5G technology? The reason is because we have many devices in the hospital, right? And indoor 5G is something still quite new, at least in Singapore. So we have just won a IMDA grant to put in indoor 5G at NUH, so we can start providing services such as holomedicine, which my colleague Dr. Gao will talk about later. So you can see at the bottom there, IoT sensors, effectors, they are holomedicine kind of devices, as well as a new generation of robots called cloud robots, right? These are robots that function on physical robots that have their brains in the commercial cloud. So that's how we intend to scale up using 5G and AI, because we need the ultra-low latency and high bandwidth connections for these devices to work properly in the hospital. So I hope I've given a glimpse of what is possible when you put in, you marry digital technology with the demands, the new demands of healthcare that has emerged after the pandemic era. And with that, I thank you very much for your attention.
Thank you, Professor Lim. I think he's very clear to explain how deep to the ground, how the technology being applied, to support the transformation of healthcare services. You see the benefit for the elderly, a lot of automation with AI become possible. With 5G, we also see it can really provide a very good enabler as a backbone to support this. So next, we are very honored to invite a pair of speakers coming from Thailand. Let me just firstly introduce Mr. Tharapon Itas Sakutichai. Sawalikai. He's the Chief Enterprise Business Officer from AIS, the leading operator in Thailand. And then next, we have Remote Hospital, Parapon Charanpon from the IT Director from Remote Hospital. Welcome.
Okay.
So they are going to have a joint presentation and have some fireside chat with me. So first of all, I really want to give thanks for them to coming. And during this pandemic period, actually it's very difficult for I think healthcare sector. They're doing a lot to support that's why we are here. We're still alive. I mean, it's not easy. I think they are working very hard day after day to support. So actually, everyone aware, Thailand actually is developing very good on healthcare tourism business. Some of my friends from Hong Kong, they find the Hong Kong services is not good enough. They will visit Thailand for body check. They see that there's a hotel kind of experience, right? So I would really like to hear from Mr. Parapon. So can you share us about more about your hospital? How is it?
Okay, I'm very glad to be here to share my experience at Remote Hospital with you all. So first of all, can I introduce Remote Hospital? The Remote Hospital, we have the 55,000 square meter, and we have the 236 beds for the IPD, and we also have other major facility like operating room for the 8 room, 3 rooms for the labor, and we have 1 room for the catheterization laboratory. So we opened the service on the last year, 1st May, so during the COVID situation. So we have so many 100 beds, so we can consider ourselves as the tertiary care healthcare service. So to treatment for the complex disease for the patient. So we also believe in the early detection is the best prevention. So the thing that make us different, we have the geriatric center that support the need of the aging society. And we also have the transitional care ward to make sure that the intensive care the patient have the good, better recover before allow the patient to going back to the home. This one is make a difference. So originally, so I would like to say about that. Weymouth Hospital is a subsidiary of the Pruksa Real Estate. Pruksa Real Estate is the one of the most company to success in the real estate industry. The founder, Mr. Thoma Vichit Pongpan, he made a lot of the people have the home with the reachable price. So when a lot of the people have the home, he think of the health. How can make the people access to have the good health with the reachable price? That's why Weymouth Hospital happened today. This one is the story of the Weymouth Hospital. So Weymouth Hospital, we aim to be the trusted healthcare platform. So we have the physical hospital. Currently, we have the one hospital, and we plan to have more tertiary care level, maybe 2 or 3 or more in the future. And we also have the clinic and the nursing care for the senior living. We make the people have the easy access to the clinical service. So we put the clinic and nursing home in front of the village to make them easy to access. So we also have the community to exchange the expert knowledge together. And also the last, we have telemed to let the people access the healthcare service without going to the hospital. And definitely in the healthcare industry, so we need to cooperate with medical school, insurance for the claim, and the partner like the laboratory and pharmacy. So this one we call the healthcare platform that we do. So it can link the hospital information together, and definitely it can share the resource together like the medical staff and process together. This one is we are going to be the trusted healthcare platform. So in the healthcare industry, definitely the challenge that we are facing today is how to make the people have the good patient experience. So patient experience have a lot of the meaning. So with Weymouth, we have 4A to related with. The first A, available. So it means hospital need to be always on for the 24 hours, 365 days a year. So it means the data need to be always available to the doctor and nurse to ready to treatment for the patient. The second A is accessible. Only available is not enough. Need to be let the people or patient access the medical service easily. So the channel need to have more than one, like walk-in channel, book channel, or maybe telemed. This one that we need to do. And the third A is about assure. So in the healthcare industry, the quality assurance is the most important. You can think of some wrong information maybe lead to the wrong treatment for the doctor. So this one we need to make sure everything is good quality. And the fourth A is about affordable. So the medical service, we need to make sure that the price is reachable. So the data is quite helpful for us to make the analyze and create the package service with a reasonable price to let them access the service. This one is the challenge today that we are facing. So we have the good partner that help us to do this one to solve the problem. Let me ask him to continue.
Yeah, thank you. Thank you, PowerPoint. So I think this 4A is very meaningful for not only healthcare, I think for every industry. But of course, for healthcare is especially important. So for AIS, actually they are one of the mobile operator first roll out 5G since 2020. So I think after 2 years' time, we will really want to hear how you, as a mobile operator with 2 years journey of 5G, and how you work together with a remote hospital to achieve this 4A.
Yeah, thank you, Terence. I'm very happy to be here. Actually, the 5A is AIS. And so it become 5G. Well, let me introduce a bit on AIS side. Basically, we are the leading digital provider in Thailand. And our mission is very clear to embarking on how we drive a digital economy for the country. We have a truly belief that digital will drive 40% of Thailand GDP in the next 3 years for sure. So this is where we see the challenge and also problem at our customer as well. Now, 3 key areas that we're really focusing on. The first one is how we help our customers to accelerate the transformation, how they leverage the technology that we have, with the full suite of the technology that we have. And also last but not least, to build the capability in the country. I think you heard from the several sessions on talent, I think majority of the country that face the challenge, the same thing is talent and a lot of people that we can bring more on board to help our customers to solve the problem, right? So we come up with 5 strategies that we deploy, and we put this as a focus area and what we want to achieve in the near term. The first one, we build an intelligent network. You heard a lot of word, techco, the cognitive telco. That is the thing that we can bring more intelligence into the connectivity. It's a basic digital infrastructure that we can deploy. Secondly, it's on the 5G, the ecosystem and partnership. I think thanks to the APAC 5G IC, I think that's part of the program that we participate. We need to work together as an operator, how we can create the community and also leverage the strength, not only among telecom operators as well. We are talking about IT partner and also OT partners. This mission we cannot finish by ourselves because we still don't know what we don't know a lot. And today, what we're going to share you about with Moodcase is not about the technology, but how we embarking on this journey and also learning, as well that we work with the customer. We want to deliver the platform for Thai, on the digital, platform. You might heard about we also, deploying Paragon platform, that we collab with Singtel. That will be the way to speed it up the adoption, the way the customer deploy the application, the SI, and all the vertical solution that can be deployed in 5G platform with a very rapidly way, and also that help customer to bring the system alive with more affordable. Previously customer need to invest a lot in terms of the CapEx or investment to drive this kind of innovative, but it is not for now, and Vimwood will be the good case. The fourth area will be the data-driven business. As we know, we have a lot of data, within our organization, data within our customer, and also data will be a natural asset for the customer. 5G will bring the new and unleash all the potential of the data, toward the business as well. And last but not least is to build the capability in organization. I think most of you, may be facing the same challenge like us. We grow from telco, we know telecom, how can we moving forward by embarking on the new journey on the digital, cloud, cybersecurity, IoT, so on and so forth. It takes time and encouragement to bring new skill on board and also reskill our people really quickly. So to driving this platform successfully, not just jumping from mobile and then we shift to 5G business. There's a lot of the component behind the scene that we built in the last 2 years. On the network side, I think that is bread and butter that we're really keen on. I won't focus that much, the edge computing network, but we build a lot of capability on the IoT solution, OT partner that we work together, and also, the capability like in the cybersecurity area, which will be a key important milestone. We don't want to be a very strong cybersecurity company, but how we apply this cybersecurity to our core product and also building more value to the customer. I think that's the way we do. So the work that we start with Vimwood is from the framework that we put in last 2 years. While we believe in co-creation among the best technology, the one who know technology and the one who know the business problem, right? So Vimwood will be another good case that we work together very closely. Previously, we do the we call the yacht quarantine. We quarantine people outside Thailand in the yacht, and we're using IoT technology to detect their temperature or whatsoever, and we save a lot of cost, of the doctor to go in and out, checking those people 7 days before they can, land in Thailand, Phuket Island. So it will be the journey between technology and industry work together to come up with the use cases, right? So I think for the Vimut cases, it's really challenging for us because Kun Thong Ma, which is the CEO and founder, they have a very strong, mission to make this happen in a very short period of time. I think we can share that pain together. In a very short period of time, that is the first challenge. The second challenge also, how we can, using the digital technology to democratize the medical services, and especially last 2 years, right? I think we know the challenge on the pandemic, right? And that will be an opportunity at the same time to drive the behavior change. The customers still need more services with contactless, and also how we can democratize it, make it lower cost and affordable, to all the people. That will be 2 key areas that we work together very hard, how we can provide the best solution for them, and we need to deploy at the right time. So we work together on this and, to understand each other. The tough part for AIS also to understand healthcare process. The APAC system, the back-end system, how do we integrate those information together and flow into the system? So we deploy is a very deep integration with the healthcare process inside, not just, another island, the digital product or solution. So that's where AIS also need to learn a lot about the healthcare process, and also we try so many things and something we fail. We should learn and then we build that product and solution. So it came from 2 major technology that we put together on 5G, especially on their performance, speed, and real time, and also massively data transfer, and also putting more roadmap on the AI/ML that, the most important is the customer data and experiences that we can tap on. I couldn't agree more with Dr. Kim Yam putting about chatbot, talking about everything is data, right? So 5G will enable everything. Right, so with Vimut, we starting from the infrastructure. So if you remember that chart, we provide them total picture of IT outsourcing, building the data center, building the system, manage services. That's where we can beat the timeline that we need to achieve to start up operation as planned. But on top of that, we also bring in more 5G technology and also the high quality on the telemed, which we can provide a good experience, good quality for the customer, and with the lower cost as well. So he will talk about that more and more. And in the future, we also have a roadmap to build more, product and also services that we continue to learn and develop together. So with here, there are the full stack that we deploy. This is something we deploy already, and we also have the roadmap for the future as well. So as I mentioned, we totally manage all the IT services, and this is 24/7 operation that we're supporting. We move in the real operation, starting from data center network, WAN, cloud, including contact center. Secondly, we develop the telemed app, to patient, and this is not just from AIS. We move and us work together. We design UI UX. We need to understand how doctor flow, how they embedded this in the process. And the last one is the COVID vaccine services. I think all hospitals have the same challenge. Suddenly, you need to open to the public for the vaccine reservation payment, and that is massively, hit the hospital system. They didn't prepare for that kind of tsunami of the people call in, scheduling, logistics, something like that. So that one we also be able to rapid the system to support very fast. That's the whole journey and the learning that we have, working with the Vimut Hospital. Thank you.
Thank you. I think it's very interesting to see how a mobile operator, they really deep dive in the healthcare sector, very humbly to learn how they can really support a healthcare sector. So Parapon, can you share us with the support of AIS, what exactly you deliver to the end user, to the patients?
Okay, definitely. So at Vimut, we cooperate to develop a solution we call the telehealth. Actually, it's a technology from the telemed by using the 5G. This one is just normal process for the tele, that the patient just download the application, register, and then connect. The nurse will ask the symptom and screening, and then submit to the doctor for the consultation. But if you have the drug, so the pharmacist will explain how to use it, and later on just do the payment online, and then the drug will deliver to the home. So this one is normal, but we apply the telemed with so many areas. So for the first one, we apply telemed for the quick call. I mean, when you have some maybe just headache, just to do the instant call, quick call to the doctor. So, and the next one, we do the tele-home call, just follow up for the patient. Normally for the inpatient, after discharge from the hospital, we use the telephone voice to follow up whether they recover or not. So we apply the telemed just to see the face and quite clear for the voice, and we can see the face whether the patient is recover or better or not. And then this one can make the patient more satisfied for the remote hospital. For the next one is definitely we apply the telemed for the COVID-19 patient that made the isolate at the home. So this one we follow up every day. And the next one we apply the tele for the check-up. Normally when you do the check-up, the patient go to the hospital. The technician will draw the blood and send to lab and need to wait for about 1 or 2 hours at least. So then after that, the doctor will explain the result of the checkup. So we do apply the telemed for this case. So after the technician draw the blood and send to lab, the patient can go back to work or home. And then when the lab result is released, so we made appointment between patient and the doctor will tele to the patient and explain the checkup result. This one is we are starting to do right now and increase the patient satisfaction as well. And other area that we do the tele specialist, normally when you do the telemed, so you just see the general doctor. But at Vimut, we have the doctor in each special area. For example, like the mental health doctor, this one is quite popular at the Vimut. So we also have the women health doctor that the patient can personal have the teleconference together. We have more than 10 area of the specialists. This one is make a different, and we apply this technology with the 5G, so the doctor and medical staff can see the face, the video, the voice is quite clear, quite sharp. This one is quite good. So this one is a real doctor and a real patient. And another solution that we co-developed with the AAS. So the last year with the COVID-19 situation, so the hospital is the first hospital that provide the COVID-19 vaccine to the people. Until now, it's more than 220,000 doses that we provide to the people. And for the process, for the booking, reschedule, and until we need to submit the data to the government of the health Thailand. And some the COVID-19 in Thailand is optional for the private hospital that made the private hospital can sell to the patient. So this one, AS developed a solution that can make the patient pay the online payment and can reassign to their own family. This one is quite complicated process. So because maybe you are the father and you buy the 4 doses of the vaccine and you need to apply this 4 doses to your children. So this one, AS developed this process for us and can reduce the manual process a lot, and we can save the effort of the staff, especially for the reassign the vaccine dose to the family. This one is very appreciated for the solution from AS. This one just example of the solution that we cooperate together with AS. That's all.
Yeah, I think it's really practical to see how it already applying. Actually, yesterday I also talked to a guy who are already building a ultrasound devices that can connect it with 5G. They can pass to the the people who need the remote monitoring or remote diagnosis. So that is another thing. I think it will be coming up with another good use case of 5G. So I think we just start the journey of 5G, right? So we want to hear more about what are the future, what are the next. I think this is just step one you guys doing together. So what are you planning to do in the next? Can you share more, some future things exciting us?
Sure.
Okay, maybe I just share for my side first. So Viwood Hospital, we plan to be the trusted healthcare platform. So rather than the physical hospital, we plan to have another one is the virtual hospital. So it's a kind of, maybe someone called the metaverse. So, but the metaverse or virtual need to be able to link together with the physical. This one is we plan to be, and it's very exciting if you can have the representative in your virtual or maybe your avatar, see the doctor in the virtual world, and then, but in case of the complex disease, maybe you can go to the physical hospital as well. This one we are starting to do this one of the concept right now.
ครับ basically I think on the technology part everyone probably excited but the most excited part is how they apply to the use cases. You can see that from just the telemed they can apply to solve several issues and problems from manual to automatic customer satisfaction handling times. I would say if we take it back as a business as usual, probably we cannot up and run operation, in a short period of time, but we can make it. So, in the future, we believe that we can even exercise more technology on the remote operation, sophisticated, cases that we can deploy and using 5G to help, to provide more services. And at the end, he's talking about how we can, put together online, and also, virtual hospital to serve the customer. I think this will be the interested segment, that will benefit from 5G, which it is not the healthcare side that we can leverage our technology and also the capability, but the more we spend time with customer, understand their pain, I think the more benefit that we can gain out of 5G. So I would encourage, every telco start to see or pick the area that we would like to go deep, right? Sit with the customer and also, many things we also learn from the customer as well, on the detail, different kind of services, what kind of services, can use. And it's not all the case we can use telemed, but they know the best which one should be the one, psychology, symptom whatsoever. So, it will be a good journey to moving forward, and definitely, we still learn a lot together to know what should be the next, the solution that we can provide to the customer, and collaboration is the key that I like to emphasize, and also, how we put the effort and also learning together to make this happen. Thank you.
Thank you. Thank you.
Thank you.
So So I'm really looking forward. Maybe next time my friend doesn't need to go Thailand. They can enjoy the virtual metaverse healthcare services. Yeah. So since we talk about metaverse now, next I would like to invite Dr. Gao Yuja. Is the Vice Chairman of the Holomedicine Association. He's also the Assistant Group CTO from NUHS. Welcome, Dr. Gao.
Hi, thanks, Terence. First of all, a big thank you to Terence and the organizers for having me here on this podium. So my name is Yutia, and like what Terence said, I'm from the National University Hospital, and I'm here to essentially talk to you a bit about the use of mixed reality in healthcare and medicine, which we term holomedicine, and how 5G actually ties all this in together. So my specialty is in liver, pancreas, and liver transplant surgery. So that's where I practice in NUH itself. So there's some declarations and disclaimers before I start the presentation. So what exactly is holomedicine? So holomedicine is a combination of the terms hologram and medicine, and how we actually use holographic representations and holographic images in clinical practice. And the main aim is to really enhance the way we deliver healthcare to our patients and to improve patient outcomes. So holomedicine and mixed reality exists in the spectrum of what we call extended reality. So we're all very familiar with virtual reality, augmented reality. Mixed reality aims to incorporate the best of both worlds when it comes to VR and AR, in a sense that you're getting a virtual overlay on the physical world, right, which devices before this have not actually been able to achieve. So there's a lot of talk about how this is actually going to change healthcare, but how is it actually going to be done? So the use of VR dates back to the 90s or even the 70s and 80s, where it was mainly used for medical education and some psychiatry use cases, but it never really caught on because we always exist in a fully virtual world. There's no interaction with the real world. AR helped to break some of that, but most of the traditional AR devices that we're familiar with essentially gives you a two-dimensional display, which you can't really use all the time in clinical practice. So what about mixed reality, and what makes it so different from VR and AR? So mixed reality devices, the two of them that are leading in the market at this point in time are the HoloLens 2 from Microsoft and the Magic Leap 2 from Magic Leap. The thing that sets these devices apart from AR and traditional VR devices is that it allows the device to know what's going on in its environment. So it understands its environment like how a human would try to understand its environment. And what do I mean by this? So the HoloLens 2 and the Magic Leap 2 devices, or other mixed reality devices in the market, has a suite of sensors. So they have IMU sensors, they have cameras, multiple cameras, they have infrared sensors on them, all with the purpose to essentially visualize the world and to perceive and experience the world how a normal human would. So these devices don't have GPS on them. Essentially, they create a point cloud and a point map based on the camera feed, and it knows exactly where it is in a room, where it is in space, and what's in front of them. So this is what we actually get from the camera feeds from mixed reality devices. It is not a single, red, green, blue kind of a feed. It's multiple feeds that's overlaid on each other, multiple layers of information that allows us to extract all this information in real time and perform real-time analysis on them. And that gives us the ability to do things like this. For example, visualizing a patient's veins using the infrared camera on the HoloLens 2. This is done in real time. There's no pre-scanning done for the patient. You just put on a device, turn on the cameras, look at the patient, and it shows you the veins exactly where they are. The cameras allow us to track objects in front of us very accurately. So things like digital twin, holo twin, right, creating a hologram and overlaying it on a physical object. These are things that are possible now with mixed reality devices and HoloMedicine. So how do we actually use it then? Right? There's a lot of areas that we can actually use this technology in clinical practice. We can use it in surgical planning, surgical navigation, remote proctoring, real-time image analytics, augmented situation awareness, as well as increased connectivity to create an entire ecosystem on which a healthcare system can exist. Right, so these are some images from NUH where I practice. So these images are taken through the HoloLens device. What you see is actually what I see when I wear the device itself. Right, so what you see is that there is a virtual world overlaid on the real world. Right, images, for example, patient CT scans, MRI scans, PET scans. From a two-dimensional scan that you see on a computer screen, now it's a three-dimensional hologram that I can then superimpose onto the patient, and that literally gives me so-called X-ray eyes, right, to see through the patient, and I know exactly where a tumor is. Right, we use it for multiple different use cases for intraoperative guidance. So we've tested it for the last 1.5 to 2 years over at NUH. We have done our trials, and now essentially we're conducting further research on how this can be applied in the operating theater. So this is one of the videos that we took from another colleague of mine. So this is for liver transplant surgery. And what we're doing, or what we did, was that we converted the patient's CT scan into a 3D hologram, did segmentations to identify the vessels, the veins, the bile ducts, and we overlaid it onto the patient during the surgery. And the screen that you see here, this is a virtual screen. This is not a physical screen. And we're getting a live feed from the camera that's inside the patient, looking at the internal organs of the patient, and we can actually match, right, the hologram as well as the image that's coming from the laparoscopic feed from the patient. So all this happens in real time. All this needs extremely high bandwidth and extremely high uplink and downlink transfer speeds for this kind of technology and capabilities to happen. So we don't need to do it just for keyhole surgeries. We can do it for open surgeries as well, right? We can overlay the patient's structures, holograms on them during the surgery, and we know exactly where all the structures are. In this case, we're looking for the blood vessels that's going into the liver. Now, talking about the metaverse, technologies like this, it shouldn't exist in isolation, right? It is not meant for us to use in one space and one place only. It's meant to be connected. It's meant for us to join the rest of the world. So this is me doing a recording in my office in NUH, right? I'm just playing around with some of the holograms. And what you'll see later on is my partner and colleague, Circle, this guy here. He's in Hamburg in Germany. So he's technically joining me in a healthcare metaverse, right, as an avatar in real time. So he's wearing his HoloLens in Hamburg. I'm wearing my HoloLens in Singapore. And we are communicating in real time through the internet, right? We are interacting with the exact same holograms. He can move it. He can see what I'm seeing. I can see what he's seeing. And it's real-time discussion. Right? So these are things that's already happening now. It is not a myth. It is not a wish anymore. But of course, a lot more needs to be done to make this more seamless and more user-friendly. And this is where 5G is going to come in. So the other thing about why we need 5G, it's because nowadays we talk about cloud computing, right? And how is it actually going to be useful? So we all know what the benefits of cloud computing are, but how is it going to fit into the whole holomedicine picture? And how is it going to fit into the mixed reality and metaverse? Now, the thing about cloud computing is that it gives us the opportunity to have a lot of computing power with very little footprint, right? But that requires a large amount of data to be transmitted in real time to and from the devices that we use. So the thing with existing Wi-Fi networks or broadband networks is that it just doesn't have enough bandwidth for us to do what we want to do. Imagine having a connected operating theater, right, where the robotic arms, the anesthetic machine, the operating theater itself, the laparoscopic stacks, the remote sensors that we are wearing or we're putting onto the patient, all communicating at the same time in the same space with the same device. So that's a lot of information going back and forth, and not just download, but upload as well. So the thing is, 5G is needed for us to do things like this, right? For the surgeon to wear a mixed reality device, in this case a HoloLens, be able to see what they want to see, be able to project what they want to project, using real-time image analytics and data analytics, and perform a surgery, all under the guidance of artificial intelligence, computer vision, right, real-time image analytics, and of course, 5G connectivity in the background. So how do we actually bring it all together then? So that's where 5G comes in. So in NUH, we have Wi-Fi system, right? We have Wi-Fi 5, we don't have Wi-Fi 6 because it's too expensive. But we all know the existing problems with Wi-Fi, right? Be it Wi-Fi 5, Wi-Fi 6. There's good downlink speed. There's okay-ish uplink speed. But again, we are using an unlicensed network, right? The benefits of 5G is that it gives us a huge bandwidth to transmit data in real time, both up and down from the cloud. It gives us capabilities, for example, massive MIMO, enhanced beamforming, multiple user interfaces, a reliable licensed network that gives us a better security insurance compared to a unlicensed open Wi-Fi network. So we have done some tests when it comes to real-world data and how 5G actually is going to help us, right? Because before we commit to building a 5G network in the hospital, we're going to make sure that it works. So we worked with IMDA and Singtel to essentially look at some of the connectivity data and what 5G actually is going to offer us when it comes to transmission speed. So these are real-world data and real-world numbers, which we have done in some of our tests when it comes to Wi-Fi 5, 4G, and 5G. So these are numbers from the sub-6 network on 5G, not the millimeter wave ones. And these are numbers that's extracted from the HoloLens itself, which is the device that the surgeons and the clinicians use. So it's not using a peripheral device, but it's using the actual device that we are using in the hospital itself. Some of these numbers and some of these differences don't really seem that significant, right? We're talking about a few seconds, you just count 1,000, 2,000, it makes up the difference. So is it really worth taking the jump from Wi-Fi or 4G to 5G? So this is how I'll put it to you. The image on the left is 4G. The image on the right is 5G. The difference is not very big if you look at it, but it is noticeable, right? If you're using it at home, playing computer games, watching movies, sometimes you get a frame drop, you get a frame lag. That's fine. But it's a different story if this is happening during a surgery, right? If during a surgery, you get a frame drop, you get a loss of connection, you get laggy images that come in through the cloud, right? That affects the surgery, and that may in turn affect patient outcome and patient safety. So if let's say we intend to use this technology in real time on a living patient on the operating table, we have to make sure that the network is able to support what we want to do, and we're not going to have a network failure halfway through the surgery, right? So to tie all these things together, right, devices like HoloLens, mixed reality devices, IoT devices, like what Prof. Niam has mentioned before, they cannot exist in isolation. They have to exist in an integrated network, right? Meaning that there is a seamless transfer of data from the hospital's electronic medical record system to the cloud, to the AI engine that processes all these things. And the backbone of all this data transmission is 5G connectivity. Of course, there will be hurdles and challenges when it comes to implementing things like this in a public healthcare system or in any healthcare system for that matter. First of all, is technology readiness. Is the current technology ready to be brought into production, or does it need further research and development? Is data security good enough? We're dealing with patient data, we're dealing with sensitive data. Can we make sure that the data being transferred is secure? Governance and regulations, are there rules and regulations to actually govern the use of such technology in the healthcare space? User acceptance and also system acceptance and readiness, right? Are we as surgeons, are we as clinicians ready to accept a technology like this in our practice today? So what we should imagine is that in the future, hopefully, with 5G, 6G, 7G, metaverse, increased connectivity, artificial intelligence, machine learning, things like that, it's not about what's the next most sexy thing that comes on, right? It's about information at your fingertips. It's about making the difference to the next patient that walks in through the hospital doors, and to make sure that regardless of whether or not we can save their life, we make sure that they have a good outcome. Right, so with that, I'm sure all of you are very familiar with this quote: the best way to predict your future is to create it. And I think this is a perfect opportunity for us to do so. And with that, I thank you.
Thank you, Robert. So I think it's a very innovative things they are doing. So I believe there's a lot of journey to go. It's just beginning. So now next we have a panel. So let me introduce my colleague, Joseph Warning, our Asia editor for Mobile World Live. He will introduce the rest of the panelists.
Hello, everyone. Thanks, Terrence, for inviting me to head up this final session of the day. Dr. Goh really set the stage for some, I think, interesting follow-up. I do want to open it up for questioning, once we get started with the panel. But let me first call up our three panelists. We have Wing Lee from YTL in Malaysia, who actually just flew in minutes ago. Also from Microsoft, the regional business head of Worldwide Health is Dr. Karen Priyadashani.
That's the tough part. Yeah.
Sorry about that. And Konesh Koghal, he's Director of Industry Ecosystem Engagements at Huawei for Asia Pacific. So thanks for joining me. Last night I took a bit of time to come up with what I thought was a pretty good introduction for this session, but all my work was for naught because Terrence in his introduction covered about 50% of it, and then the people at the research hospital covered everything else. So I'm going to skip my introduction, but I'm going to bring up one point from Ernst & Young, a report. They said COVID triggered a sprint towards smart healthcare, following a surge in telemedicine, which fast-tracked healthcare's journey towards a smart health ecosystem. It cautioned future stickiness hinges on convenience and speed. So I just want to throw that out before we get started. I want to start with Wing and ask you to introduce or to cover one of the main healthcare initiatives at YTL and why you think it's significant.
Got it. So good afternoon. Very good to see you all.
We were the first to launch 5G in Malaysia. We soft launched in December of last year, and we commercially launched in May, just a couple of months ago. The network performance has been quite good. So, of course, our job is to figure out how to create use cases on top. I think it's safe to say that giving out SIM card is not exactly a use case. So we do that too, but that is basically table stakes. So we talk to a lot of industry partners, and I think we try to solve problem ultimately. So we've been supporting a number of different industries in our 4G business, and one of the industry that we support is in ambulance industry. So we provide telematics devices, right? So through the telematics device, we have been able to support a number of ambulances, and some of the ambulance partners that we have were quite progressive. So they've been using our telematics device that's got built-in Wi-Fi creatively, so that they can connect the equipment in the vehicle and transmit the images and files right to the hospital. So they give us an idea, and we start talking to them and said, what if we have fiber level connectivity from within the vehicle, anywhere you go? What can you do with it? And they said that, well, today's pain point is that they will transmit one file at a time, right? But when you have a fiber-like connectivity wirelessly, then I can stream. So we start imagining, so what else can we stream? So when they first used our 4G-based product, they were streaming a simple ECG scan, but it is a snapshot. And in an emergency situation, the good doctor will know that things changes from minute to minute, especially when it comes to cardiac situations. And in Malaysia, unfortunately, cardiac situation is one of the most predominant causes for death. And you guys might know that Malaysia, we don't have the best traffic system. As a result, you would be very unfortunate if you got stuck on a major traffic jam on the way to the hospital, and everyone knows that you have a cardiac situation, but no one can do anything about it. Time literally would fly off, and your life would as well. So we thought that that's a great opportunity to use this connectivity, and we add additional feeds to provide a live telemetry. Okay. So we provide ECG telemetry, we provide ultrasound telemetry. In addition to that, we start imagining what else can we do if we can have a live connection to the hospital with a very high bandwidth. Then we can do remote instruction. So the technician in the vehicle can actually get live instruction from the emergency room physicians, so that they can provide life-saving interventions, literally, when the vehicle is stuck in the traffic. And literally, life could be saved. So we thought that is a super meaningful project. And the feedback from the hospital is that they were able to cut down the time, they call it door-to-balloon time, by half.
Wow.
So that is a great project for us, because it's certainly good that we use technology to improve lives, but it's even better if we can use technology to save lives.
Right, fantastic. Well, I'll ask some follow-up questions on that later. Karen, what's happening at Microsoft in this area?
Well, I think COVID period, the silver lining has been that it's been very good for healthcare. And so Microsoft recently launched the Microsoft Cloud for Healthcare, which is basically a cloud capability with a lot of tools and capabilities around healthcare. But the interesting part is it's like a Lego block, right? So you give a base and you give smart physicians like Dr. Gao and Prof. Niem that I love working with. You give them those toolkits, and then they build amazing products on top of that. So Microsoft has been busy solving some of the problems that we see in healthcare, extremely fragmented, disconnected, multiple systems. How do we kind of bring all this together? You know, one of the things when I speak in conferences like that is amazing, the speed with which we work in retail and finance, right? Getting payments ready, you need to buy things. People just absorb technology so fast. But when it comes to healthcare, which involves our lives, which involves the lives of ones we love, it's the slowest, right? And which is what I always fail to understand, right? I'm sure many of you must have seen emergencies where, as what you were just sharing, time is of essence, you know? A few seconds, a few minutes can make all the difference. And so that is where, from Microsoft, we are trying to see how we can have tools in the hands of doctors who are really smart people who can then develop it and use it for their patients. So given that, I think one of the areas, like you called out telemedicine, I think one of the areas that I would love to call out is continuous monitoring, right? Many of you in this room have smart wearables. You have a smartphone or smart tablet, right? And how do we kind of use that to collect data, our vitals, for example. Because if, let's say, somebody has blood pressure, they go to the hospital once in 2 months, 3 months, if they remember, just to get a refill of the medication. But what if you have something that can monitor your vitals regularly and be able to kind of predict or prevent or even kind of give you an alert saying, hey, this is an area that you would want to investigate further with your doctor. So when you go to see your doctor, it's not just about, I have a cough, please give me some medication, but you're sharing data and insights and saying, hey, is this something that needs greater intervention? So I think this is the era where you're looking at data, and healthcare, to be honest, has one of the richest sets of data, right? Because if you look at your health data, you have financial, you have demographic, you have social, you have clinical, right? It's a very interesting mix of rich data set. So how do we make sense of that? Because every day when we go to hospitals or when we are at home, through our smart devices, we are collecting data. So how to make sense of that so that, all of us are living longer. Hopefully all of us will touch 100, but we definitely don't. We definitely don't want to be living with, unable to walk and things like that. We want to live a full life. So I think that's where we're looking at using technology to help us make sense of what data is being generated. So I think that's the exciting part.
Right, and that's vital because I think one of the major problems is that people get medicine, but then they don't take it. And so the doctor is totally unaware, and they can say, well, yeah, I took it.
Absolutely.
So interesting. Kunesh, what's happening at Huawei?
Yeah, sure. Firstly, to begin with, good to be physically here, interacting face to face. Now, typical healthcare is something which is naturally, we all understand, needs transformations for a long time, right? But unfortunately, pre-COVID period, the developments in terms of application development or service provider provisions or network supporting those kind of use cases were happening in a much fragmented manner. COVID ensured that we realized those challenges of growing population, urbanization, resource limitation, both in terms of manpower and beds in hospitals and ICU beds in hospitals, all the way to the growing rural and digital divide, in terms of healthcare services, to address the population uniformly. So therefore, the need was for an ecosystem transformation when it comes to healthcare industry. So where we are currently playing is bringing all these pieces together of this puzzle, as you mentioned, like Lego pieces, and trying to enable an ecosystem-driven use case. Particular example in Thailand, like we saw, one of the private hospitals that you are enabling. We started working last year with the National Telecommunication and Broadcast Commission there, along with one of the service providers, and we partnered with them to transform one of the largest public hospitals in Thailand called Siriraj, right? Now, this particular thing is of very significance because there are 30 plus use cases from telemedicines to telehealthcare and digital healthcare, smart healthcare that we are trying, which includes primarily connecting industrial logistics robots, right, to get the vitals of the patients, then to serve them food in terms of contactless services that one can enable in situations like COVID, right? All the way up to mature systems when the ecosystem evolves to remote surgeries, right? Because remote surgeries require a lot of future development, a lot of partner ecosystem to work together. So there are 30 plus cases that we want to use this setup as an incubation lab to further develop and change the entire healthcare ecosystem of Thailand to start with, and one country at a time. And APAC as a region, we all heard, is leading in this particular requirement because we are, as a region, one of the most populous regions, right? Mm-hmm. And transforming this is going to enable us to save lives. Now, it's just been a few months trying to transform such a huge infrastructure, but in few months itself, addressing 5G-enabled ambulance systems, which is connected to the hospitals, we are able to increase their response rate. The first point of contact is a paramedic. It's not a doctor, right? If a paramedic can get the right insights for the patients, transmit it to the doctor and get the right input, the treatment can improve so fast. Right. Therefore, they have reported in a few months that the survival rate has doubled. Wow. Right? And the analysis for what problem you're trying to solve or treat, right, has gone down to as less as 2 minutes and 90% accuracy of the diagnosis. So those are the initial impacts that we are already seeing with enabling a next set of IoT devices, and getting the data in time to the expert and getting the right kind of advice to treat those patients. So it's just a beginning process, very exciting, and huge learning curve to cover.
Great, thanks. Before I dig deeper into other questions, I just want to open it up to the floor. Is there any questions at this point? Don't be shy. Because my next question was already answered by Dr. Go. Literally. But I will ask Wing Lee to respond to it. It's like, how is 5G changing the landscape for delivering healthcare? I mean, is there anything to add to? I mean, I think he articulated that quite well.
Yeah, I'll refer back to his slide.
Yeah, exactly.
So I think it's safe to say that Wi-Fi is the best effort network, and it's not for mission-critical use cases such as life-saving scenarios and patient care. So it is what it is, right? But when it comes to 4G, honestly speaking, it doesn't quite cut. And I think you've shown it in real-life numbers that the latency is not there, the capacity, the bandwidth is not there. I think 5G is the first time that we have a wireless technology that approach fiber class quality. And I think that is the key, because we have been dealing with several Gs so far, and nothing could touch fiber. For the first time in our technology life cycle, that we actually have a wireless technology that can touch fiber class performance without the limitation of fiber as a physical medium. And I think that's game-changing. Now, that creates opportunity and invitation, if you would, to use that network creatively. And I think we are just now seeing the emerging of new use cases. And I think we are just at the beginning and scratching the surface, so to speak.
Yeah. I mean, having said that, these use cases are bandwidth hungry. I mean, the surgery, I hate to throw this out at this point because I'm not fond of the term 6G, but how long? We're only 2-3 years into 5G generation. How long? I'm going to ask Kanish. How long can, at this rate, in 2 years, 2.5 years with COVID, how long can 5G? I guess Huawei has a 5G plus option out there. I mean, how long is it going to sustain?
That's a very good question, because there are a lot of misconceptions, We need to step away from technology, how it is rapidly growing, 5G, 6G, these are all terminologies to enable feature at a radio layer probably, right? Whereby you can get more applications to become more intelligent, get the necessary insights digitally, connect over a platform, and therefore you could enable decision makings or convenience in life or save lives, in particular in healthcare cases. So it's not about how long 5G will sustain. 5G journey is just starting, right? We are already trying to cut horizontally and vertically to try to figure out how can 5G is not a success even now. It's just starting, right? Now, I would like to take a little step back. This transformational things or use cases that we are seeing today, it's not just that overnight after COVID, we just realize, this is how we can use 5G. In China, 5G journey started as early as 2019 beginning, right? And there were hundreds of hospitals that were trying out various use cases, utilizing 5G as a wireless layer in addition to AI cloud kind of synergy with IoT synergy that was actually solving real-time problems in digital healthcare space, right? 2-3 specific examples that I want to highlight, how 5G not only just created the wireless connectivity potential, but also revealed the synergy potential of AI cloud usage with IoT kind of applications to really solve real-time problems in the healthcare ecosystem, right? So the first one is in the month of, I think, April. The very first remote surgery was connected in an orthopedic kind of environment, where a senior surgeon in Beijing treated or operated 2 patients simultaneously. One city was almost 500 kilometers away, other city was 1,200 kilometers away. Now this surgery, orthopedic surgery that I'm talking about, is a precision surgery. Both of the patients had fractured vertebrae. In traditional surgery system, the failure of chances are high. Now these 2 surgeries lasted 1 hour, 40 minutes. 12 screws were put in the spine of the patients, right? So it elaborated that having AI for so many years, you couldn't do it. But having the last mile connectivity enabled by 5G, you could use those high bandwidth, low latency kind of applications where you could trust this technology to treat a patient remotely. Right? Few months later, there were microsurgeries done on animals, which were 3,000 kilometers away. Right? Now, why this is particularly interesting, because it's a repeat of just extending distance.
Right.
But what it ensured it that the ecosystem tried simulating network failures by force, trying to breach the system, trying to put some malware into the system to say that this system is robust, resilient, you can trust it. Right? Now, all these valuable inputs from these cases went on to value add to the Chinese specification and standardization body who are come up with the standards recently for the digital healthcare ecosystem. Now, therefore, it was not a surprise when COVID hit, Wuhan as a city, as a hospital, could be put up with 5G-enabled use cases in 2 days, because there was a year and a half of learning curve already covered, right? And it didn't stop there. We as Huawei could bring those use cases and connect hospitals in Malaysia, Thailand, Cambodia to bring those devices of MRI, CT scan, and ultrasound devices, put 5G communication modules, and connect them to experts across the globe. So 5G journey is just starting to summarize.
Okay, thanks for clarifying that. Karen?
If I can, Joseph, just add to that as well. So I think technology is one part, right? And if you're going to think that technology is going to solve the problems, the answer is a no. The thing is the will, the person who's going to be using that. And I can give an example, like what he said, if it were pre-COVID and 5G were to descend, let's say, but it's been around for quite some time, you would probably find either finance or retail running with it. But in Singapore, I mean, and I mentioned this again, people like Dr. Gao and Prof. Niem, within a matter of 6 months, were able to adapt it. So like in what you mentioned, we also had solutions with our partners around orthopedic. But you'll be amazed the speed at which NUHS and the team here worked. We can safely say that the number of use cases you just saw is one of the global first. I don't think anybody has used 5G technology or mixed reality technology to really expand boundaries. And that is why I said, when you give interesting technology in the hands of doctors, because we are talking about healthcare, they stretch the limits. They want to see where does this break, right? And then you go back to the drawing board and technologists say, okay, how do we solve this problem? Because it's not working in this situation. How do we now kind of develop technology? So it's always like a back and forth, right? So, but the idea is that if you were to give 5G technology to 10 different countries, you will see the adoption rate is very different. If you give it to 5 different industries, you will see the adoption is very different. But thanks to COVID, as what you mentioned, it kind of accelerated the whole thing. Everybody had a common problem, and you had technology sitting on the back burner. How do you kind of use it, right? And having said that, I think some of the use cases you mentioned are ambulance and doing surgery across. One of the very simple things, right? Like when we all go to hospitals, we go into the A&E, and it's all queue number. 1, 2, 3, 4, right? But using 5G, you can actually have smart wearables and sensors that can tell you, hey, this guy who came in number 30th is deteriorating much faster than number 5. So the doctor needs to call in this person faster. Imagine the nurse, if all of us were sitting in a room, or the nurse has to go checking the fever. No. That's not going to work. So with smart wearables and with 5G, the nurse gets an alert that, hey, number 30 is deteriorating. So there are so many use cases that we can develop. I think it's just the imagination and the creativity that the individual behind the technology has. And I think in Singapore, thanks to the work that Dr. Gao and Prof. Niem have done, it's been amazing. We in Microsoft have been just blown away by the way they have just kept pushing the boundaries of technology to see, does it work here? Does it not work here? This is a problem. Can I use this solution to fix it? If not, let's go back to the drawing board. So it's just sky's the limit is what I would say when it comes to 5G.
Yeah, wow, that's fascinating. Just a few years ago, we were grappling over what's the use case for 5G. Why should we invest in those networks, which is no longer the case. Wing, I want to shift gears to government policy. You work in a single market. How is Malaysia supporting your initiatives?
So the government is super supportive of going digitalization as a national prerogative. I think it's safe to say that they look at that's a national digitalization blueprint, and I think 5G is a key enabler of that. I think we talk about this afternoon the power of how AI can be literally where you are, wherever you are, because of 5G. I think that is a very powerful concept that cuts across multiple industries, not just healthcare, like agriculture, manufacturing, logistics, the list goes on. So we have been investing a lot in terms of cloud infrastructure around the world, and thanks to our friends here, plus other public clouds, we are seeing a lot of excitement and rich services. Now, we are also seeing a rich amount of data going up to the cloud. So the combination of big data and the machine learning models that's emerging throughout the world, we are seeing a rapid cross-pollination of really industry-specific, domain-specific AI models that can help industry transform. And to the extent that 5G provide that zero latency, near zero latency. I mean, zero latency is a marketing term, no such thing as zero latency. But single digit or even teens type latency access to the public cloud, you're literally as good as having a high bandwidth access from the desktop, wherever you are. So that real-time delivery of AI is a big deal. And that's what transforms industries. This is the first time, right, in our little career that you can have AI literally wherever you are because of the wireless, high broadband, high bandwidth, high reliability connection of 5G.
Karen, I want to throw that question at you. Microsoft is a global company. You're not working in one market. So, can you give us some
No, absolutely. I think before 5G came, we had AI, right? And there were so many AI models that were built. Just to share with you an example, when, those of you who have kids, young kids, you take them for their regular checkups or whatever. So once when I was I had taken my 10-year-old daughter, the doctor turned around and said, oh, she's going to be taller than you, Karen. I said, of course she's going to be taller. I said, no, look at the data. And then she turned her screen around, and you could see that AI has predicted the best, the most possible, and the least possible. And almost, I think the least possible was probably my height. All of that was higher. I said, wow, that's exactly what we want, right? We want that. We go to hospitals, you collect data, but AI and ML models are now like really, I would say, very comfortable technology, right? And what you mentioned with 5G, that has pushed the adoption, right? And I think, also because I have a bias coming from the tech side, I think any kind of checkups we do should be subject to AI. Whatever lab reports we do should be subject to AI. Right. Not because it's going to displace doctors, but it makes the optimal use of doctors' time. Right. Instead of, imagine you have a medical record that runs into screens after screens versus AI says, oh, just look at these 5 things. They seem to be anomalies. I think that's where the doctor can really focus and get more insight. Right. Of course, it's there, like these technologies need to be very reliable. They need to be foolproof. But if we never try, we're never going to get there. Right? It's always a kind of a chicken and egg situation. So I think with 5G, you're absolutely spot on. Some of these technologies that were probably not very well adopted or adapted to, like AI, machine learning, are going to make a huge difference, right? And coming back to my earlier point, all of us are going to have some form of chronic disease or the other as we grow older. So what if you're able to predict well in advance that, hey, Karen, given that you eat a lot of curry, these are some of the risk factors that you're going to have, and you better start watching out. Once you hit your late 40s, you got to do this. So that's the kind of intervention and insights that we would love to have from our local GPs when we go and meet them, right? Now that Singapore is moving more towards community care, and your GP is going to be your point of wellness and health, right. This is the conversation we want to have with our physician, that, hey, are you doing this? Are you doing your morning walks? How is it doing? What does the data look like? Are you compliant with your medication? Let me take a look, and you have data. You can't fool it.
Wow. Seems a bit fatalistic.
So that's the world that we want to live in, which ultimately results in better health. Yeah.
So thanks. We have 5 minutes left. Again, last call for questions from the audience. There we go.
Question for maybe Karen.
Yeah.
Hi. I know you've touched upon chronic disease management. What about infectious disease management? Are you developing any models for, including for dengue infectious disease? Because it's a big problem in Southeast Asia. It's a big problem in APAC.
Yep.
Are Microsoft doing any projects, private pilot projects together with NUHS, perhaps?
Oh, wow,
in Singapore?
That's an interesting question.
That would be an idea. Just a question.
Yeah,
because it's so important, that topic.
Yeah. See, one of the reasons, and this is a very personal point, right? One of the reasons that I'm very proud to work at Microsoft is that they do go after problems which have not been solved, right? So dengue is one of them. So if you look up, if you search for Project Premonition, you will see the work that we're doing with dengue, where we're saying, is there a way, even before you have a dengue hotspot, can we say which are the hot clusters? You see? So you basically use the Anopheles mosquito, you do analysis of the blood and see if there is an increase, for example, in a particular area. Before people get bitten and then there's a problem, are you able to predict which are the hot spots and where you need to have intervention? Because now, as you see, once you have a lot of number of cases, you have that banner coming out, red alert. We don't want that. We want it before. So that's around dengue kind of this thing. But with infectious diseases as well, we're doing a lot of work, especially COVID has accelerated, where we are saying, hey, can we have, one of the problems in COVID was that they didn't know how many people were vaccinated, how many people yet are high risk, for example, right? Everybody was called to be vaccinated just by age. Okay, 80 and above, 70 and above. But that's not the way that it should happen. The smart way of doing it would be you have a platform. Let's say you have a population of 5 million, all of them profile, and then this is the cohort that is at high risk for the next epidemic. They should be vaccinated first. That is how you work in a very smart way. And that is some of the work that we are doing now in anticipation that there are going to be many such, epidemics coming up. So yeah, that's the work. But do look up Project Premonition. You'll be surprised.
Right.
Yeah.
Thanks. I want to ask the big question. Ganesh, what's next? What are you really excited about?
To be very honest, excited about the engagements this whole initiative is creating, because as a collective society, we are trying to understand each other and trying to solve the real problems. And partially to answer your first question about regulation policy, what essentially we are doing is stepping away from technology, because we want this solution to be sustainable. We want to drive adoption. And the only way you can do it is by building trust. Right. Therefore, coming collectively together, trying to understand the problem at hand, then trying to put technology solutions, how we can solve those problems in a secure manner, because we are talking about saving lives. So now identifying the right problems to scale, that is something which is exciting us, and building these solutions and bringing them to the market.
Wayne?
I think we are at the early stage. Many countries are running 5G NSA. I think the real 5G is 5G SA. With 5G SA, with network slicing, and with private network capabilities, I think we can really allow for mission-critical use cases, and with the security and privacy control needed to respect the patient's right. So that's not something that people talked about, but it's something that is absolutely crucial if we want to really go at scale. I mean, when you go into a lab environment, people, okay, life goes on. I give you some data, I hope you do it properly. But when you do it at scale, you better make sure that you don't get sued, at least in the context of a patient's right. But that's also a trust issue as well.
Great. Well, fantastic. We're just about out of time. I want to please join me in thanking our 3 panelists for their insight on this. We could go on for another half an hour. So if you want to stick around, we can